Hello everyone, welcome to sqadia.com, and in this fifth section of our lecture topic, implantation and early pregnancy, we will talk about gestational trophoblastic disease. Gestational trophoblastic disease also is abbreviated as GTD, gestational trophoblastic disease. So we will talk about different causes, how it presents, what's the complication, and what is the management of gestational trophoblastic disease. Gestational trophoblastic disease, originally starts in the trophoblast layer that develops into the plasma. So trophoblastic layer is the layer that later on in the pregnancy form the placenta. And it's the outermost gestation. Trophoblastic cells are present in the outermost layer of the blastocyst. GTD or gestational trophoblastic diseases are mostly the benign. They are benign, but some of them are malignant. They can be complete, partial, invasive, mole, hydatiform mole. Hydatiform mole is the most common form of gestational trophoblastic disease, and molar pregnancies in which the hydatiform moles are formed, which is like swollen villi of the placenta, which gives the shape like a bunch of grapes. So this is very common form of gestational trophoblastic disease, also known as the molar pregnancy. And then there is also choriocarcinoma. It's the other form of gestational trophoblastic disease. That's the malignant carcinoma, choriocarcinoma. If you see in these diagrams, this is complete hydatiform mole. So in this, the uterine cavity is completely filled with the molar hydatiform mole, and they are swollen sac-like structures filled with the fluid, and these are the villi of the placenta filled with the fluid, giving the shape of the grapes cluster. And this partial mole, partial hydatiform mole. On one side you can see there is mole, and then on the other side this is the fetus growing. So this is partial, not complete. Fetus is also growing along with the mole. The same here. And this is invasive type of mole. Here, if you see, it's the mole is invading the uterine wall, the muscle layer of the uterus. So it's the invasive mole. Choriocarcinoma is the malignant type of gestational trophoblastic disease, and it spreads very fast. It can rapidly spread to the lungs, and it can also spread to the brain. And this is placental site trophoblastic tumor. This is developing at the site of the placenta here. This is the placenta site trophoblastic tumor. So these are the different type of GTD, mostly benign but sometimes malignant also. An example of malignant GTD is the choriocarcinoma. What are some diagnoses and complications of GTD? HCG levels are monitored. So HCG level is done to find out the molar pregnancy. Ultrasound is very important. Here, if the ultrasound is done, you see these are all the fluid-filled sacs. AC, you can see these are the moles, hydatiform mole, fluid-filled sac. This is also the picture of the mole after they are out of the uterus. This is intrauterine ultrasound picture of the mole. Examination of the placenta after the delivery is important to find out if that it was malignant or benign condition. If there is malignancy suspected, it should be further treated or followed up is important. Then test of spinal fluid done to find out if there is any spread of malignancy to the brain. CT scan is also done to find out the spread to the lungs and the brain. Then the management of gestational trophoblastic disease, D and C, which is dilation and curettage, is done to remove the uh, molar tissue from the uterus. Hysterectomy, in case it's invasive or it is malignancy, hysterectomy is done to remove the uterus, so it is in order to avoid the spread of the malignancy. This is important. So if the uterus is removed, the chances that the malignancy will spread more to these further areas will be reduced. Histopathology, you send the tissue to the lab for checking if it was benign or malignant growth. HCG levels are measured if they are low or the high. After the molar pregnancy, it is better to avoid pregnancy for 1 year, and for avoiding the pregnancy, it is better to use oral contraceptives, no IUDs. Intrauterine devices can damage the uterus, which is already not in a very good shape after the gestational trophoblastic disease. So this is the management of gestational trophoblastic disease. Molar pregnancies are not very uncommon. It occurs mostly, and sometimes females just they bleed and abort on their own. But DNC is required to clean the uterine cavity. So this was all about gestational trophoblastic disease, and with this section our lecture topic implantation and early pregnancy comes to an end. Thank you for watching sqadia.com.